The shooting death of Unitedhealth CEO Brian Thompson has sparked a national conversation around the frustrations over how the company handles some claims. In a new investigation, Propublica looked into the claims of one Louisiana mother who says Unitedhealth is limiting access to autism therapy for her son. Propublica reporter Annie Waldman is joining me right now. Annie, great to see you. I mean, you profile a mother, Sherelle Menard, and her son Benji, who has autism. He was diagnosed, as you're right, with severe autism at the age of 3, received treatment, and even the family was celebrating that he would start to speak, a few words, and they started looking at the potential future of Benji very differently and hoped for more treatment. But that something changed, right, according to your reporting, and then suddenly UnitedHealthcare cuts back on the treatment. And then there was a discovery of some sort of secret internal cost-cutting campaign. Tell us about all of that, because it is a very lengthy and great article that you write. I tried to truncate it there, but fill in the blanks for folks.
Yeah, so this year we have done a lot of mental health and behavioral health care reporting, trying to understand how do insurance companies work when they determine what is medically necessary and what's not. And over the course of our reporting, we obtained leaked documents from inside United Health Group by way of their subsidiary Optum, which manages their mental health benefits, that have revealed what is effectively the company's internal playbook for limiting mental health coverage. And in these documents, we uncovered a secret internal cost-cutting campaign that essentially is targeting a growing financial burden for the company, the treatment of thousands of children with autism around the country.
And so that playbook that you talk about, that was developed by Optum, it was a pursuing market-specific action plans, and among those things, to limit children's access to treatment, as specifically autism or particularly challenging conditions. What was the vernacular?
Yeah, so they specifically are targeting children with a diagnosis of autism spectrum disorder, and specifically they're targeting their Medicaid plan. So about 10,000 children are impacted by this. And even though in their documents, they acknowledge that some areas across the country have very long wait lists for a specialized therapy to help these kids, the company says that they are actually preventing new providers from joining their networks and terminating existing ones who are already in the network. And what happens is that once these networks become smaller, it is very difficult for families to find, clinicians who can provide this therapy for their children, or they have to pay tens of thousands of dollars a year out of pocket for this type of therapy.
So you report Optum, whose parent company, United Health Group, earned $22 billion in net profits last year, is heavily investing in its plan to save millions by limiting access to such care. That's how you reported it. It's pretty alarming. And even in a Washington Post report, someone who worked with United's CEO, Brian Thompson, who was gunned down, was aware of public frustration with some of the company's actions, and that came before his killing. So what's been the response now from Optum or United about your reporting?
Yeah, so, United and Optum declined a request that we had and that we made more than a month ago for an on-the-record conversation about their coverage of behavioral and mental health care. We also sent them questions 11 days before our story came out, and they did not respond to them, citing the December 4th killing of United Healthcare CEO Brian Thompson as the reason. And in email, a spokesperson even told us that they were in mourning and could not engage with what they considered a non-urgent story during this incredibly difficult moment in time.
And what has been the response from the Menard family? I mean, how are they now navigating what has become an even more complicated, I guess, health journey for them?
Yeah, what the mother told me, Sherelle, is that if her son doesn't get his therapy, she worries that as he ages, he won't develop the skills that he needs to keep himself safe and help him advocate for himself. So his clinical team, which is based in Lafayette, Louisiana, they are fighting this denial. In fact, they have to go to an administrative law hearing in January to try to get this denial overturned. If it's not overturned, like many families, they may not be able to afford this therapy out of pocket, and Benji will have have to scale back the hours that he needs. And this is not just Benji and Sherelle. There are likely hundreds, if not thousands, of families who are dealing with issues with insurance companies trying to get coverage of this type of care.
Annie Waldman, glad you could be with us. And of course, folks, if you want to read the Propublica story reported by Annie, it is on CNN.com and you can see it there. And obviously, you just underscored, you believe it's a microcosm of what a lot of American families are experiencing right now. Thank you so much, Annie.
Thanks for having me.